Hello, my name's Helen Kingston, and thank you for letting me come and join you today to talk about the power of working together and our journey here in Frome. Our project began 10 years ago now, aiming to improve the care that we could offer individuals, create a stronger and more supportive community, and through that to improve staff wellbeing by enabling us to provide the sort of care we would want for ourselves, our family and our friends. We all recognise that a sense of belonging and connection and a sense of purpose in life and of agency are so important in determining our health and well-being alongside the environment in which we live. Our approach was very much a population one, wanting to enable everybody in our community to be supported to lead a more sustainable and healthy life with health advice, health promotion, and facilitating those things in our community that would make that easier and more accessible to everyone, whilst at the same time recognising that there will be those within our community who are more vulnerable and need support to enable them to access this. Been a number of key enablers to our project. One, trust that was placed in us by the county NHS, allowing devolved leadership for us to grow this scheme as we saw the needs of our population. Being a practice large enough to be able to dedicate a team specifically to this work and to earmark capacity and time for innovation, development and team building. And Frome does have a little bit of a can-do ethos already. Our town council having a flat pack democracy and a culture across the town of getting on and doing what we need for ourselves. It's really important to make sure when we shift towards better health and connection that we ensure that no one is left behind. So ensuring that we have staff and support structures for those most in need. We very much recognise what matters most, who matters most to us. So enabling healthcare to value long-term relationships, value connection, value trust, and to work alongside people for the long term, enabling them to choose their own goals and priorities. I think it's also important to recognise that not everybody is in a place where they feel able to change, and recognising that opportunities when they arise so that we work with people at times when they are most able to benefit from that. Personally, it's made a huge difference in consultations now, being linked into our community, having those resources, broadening the options and the richness of the response that we can make to the individual in front of us, having much more open and holistic conversations in the knowledge that I've got more than simply a prescription pad and a pen to offer a solution. People come looking for help. I think our learning has very much been around focusing on where we can make a difference, recognising and valuing the community assets that are already there and supporting others to grow and create capacity rather than trying to dominate everything. The appreciating that power of collaboration and enjoying others' success and growth and building team trust and capacity is really vital. and instilling a culture where connection and relationships matter and are valued as the important outcome rather than simply a byproduct, because that connection will create better care, a more satisfied workforce, and improve the sense of community. What have we noticed here in Frome? Well, certainly I feel part of our community far more. We've got a clinical team with pride and satisfaction in a job well done, and a system that allows people to feel listened to, understood, and make positive steps towards a better quality of life. We've got a team here who believe in what they are doing and are energised and inspired by that. And many of them stepping up now to build on those initial developments to create an even stronger system. And I hope very much now that our culture does prioritise connection and relationship and acknowledge their value, both across our community but also across the different organisations that work in health and social care. I think we've found a way to reconnect and re-establish a sense of agency and belonging. It's that partnership working that sustains us, gives us energy, and enables so much more to be achieved. We get great feedback from patients. Staff wellbeing survey, which persistently shows that this way of working is better for them too. We need to focus on the art as well as the science of medicine and recognise that health is more than simply the absence of disease, and make sure that we focus on wellbeing for us all.
Hi, I'm Jenny Hartnoll, and I'm going to tell you about Health Connections, which is Frome Medical Practice's social prescribing, health coaching and community development team. And I'm just going to be talking for the next 5 minutes about a small part of the whole that Helen was just talking about. So social prescribing can happen with any team member within Frome Medical Practice, whether it's a doctor, a care navigator or a practice nurse. They can do simple signposting to our website, which has mapped all the services, groups, support, resources in the community, or for people who need more than a simple signpost, who have more complex lives, they can go and see one of our team members, and they're called Health Connectors, who can work with them one-to-one on what's important to them. It could be that Health Connector sees them one-to-one, but also we work alongside GPs to do group consultations, group education, and peer support, working on the many ways to many, in that we don't just want to provide one route in and one solution for people. We want to offer them different options of ways of getting involved in our service and supporting themselves and each other with non-medical issues. So just a bit more of a dive into what happens with a health connector. So I think social prescribing and health coaching is often seen as supporting someone to access things that are external to them out in the community, in the voluntary and community sector. That is part of it, a very important part of it, but not all of it at all. So it might be about connecting to oneself, one's own knowledge, skills and confidence, or actually recognising that within oneself. It might be about connecting to others and building that informal network of support with family and with friends and neighbours, and even with connecting to pets. More traditionally, that idea of social prescribing to things in the community might be to the voluntary and community sector, to exercise classes, for example, but it might just as easily be connecting to nature and going for a walk, or volunteer driver schemes, or financial support from your bank, or getting a blue badge for disabled people from the council, or getting housing support, or connecting to lots of resources, websites and apps that are out there in the community. So it's really connecting people in or helping them make those connections themselves to what's important to them. And also for some people, it's about that wider sense of meaning and purpose. Often when people go through transitions in their lives, for example, retirement, bereavement, divorce, people also just wonder about what am I here for and what am I doing and what's that meaning and purpose in my life. Also, there's connecting outside of the GP practice doors. So some people might not want to be supported one-to-one or in a group or want to have simple signposting, but might want to go to one of our talking cafes where they can meet people, make friends, but also find out about support via our health connector who's always there. For other people, they don't want to go inside a venue, but they rather meet someone in the street. So we've got these anchor points out in the community, same time, same place, each week, called talking benches, where they can meet one of our team and just have a chat, connect, or find out about the sports in the community. So we know that in our communities there's a huge amount of support available, whether it's information on plant-based diets, access to our parks, information on volunteering, on pain management, on sleep. But how do people find out about that information? Well, as we've seen here in Frome and in Mendip, we've created a website directory that anyone in a medical practice, in any other organisation, or any community member can access. So it has a list of services, whether it's from pet bereavement services, through to dementia helpline, through to all those resources that are out there, for example, information on pain management, through to information on menopause. So it's not just about groups and services, it's also about those resources. So that's great, so people can find out about that information on a website, but lots of people don't want to find out information via a website because they're digitally excluded or it's just not their preference. So people can call up our service on the phone and find out about how to access support and services in the community. As we've mentioned before, if people don't want to go on a website, don't want to call up, we offer those many ways to many, so people can go to a physical space, whether it's a talking cafe or a talking bench, speak to one of our team members, connect into all that information and support that's out there. But how do people even find out about these things, which is what we call the access points? Well, that's where our community connectors come in. So community connectors signpost friends, family, colleagues and neighbours and strangers to those access points in their own community. It's not an in-depth conversation, it's just a simple signpost to those access points. Anyone and everyone. We're not looking for those usual suspects who talk to everyone. Of course, we'll train them up, but we just as importantly want to train those people who are isolated, who are not well connected in, because just training one of those people with our 1 hour training, they then find out about the sports available in the community, but they might go on and talk to their neighbour, someone who might be just as isolated as them, and pass on that information. So it's really valuable for us and important to train the usual suspects, but also those people who might not usually be connected in. And they can connect whenever the opportunity arises. It's not a job, it's just whenever they feel like it. And the aim is about people saying, I know how to access support and information opportunities, rather than saying, if only I'd known that. So there's a connector out in the community. We've got over 2,000 now, and we found out in the first year that they have an average of 20 conversations, so that's a year. So that's 40,000 conversations happening out in the community of community members supporting other community members by passing on information of how they access those access points, from where they can find out a lot of other information about support, opportunities and resources in the community. So these are some of the people we've trained, whether they're barbers, doctors, people we've supported one-to-one, people in gardening groups, anyone and everyone, as we said. This is a group of teachers, and as you can see, they started off with not at all confident or not so confident about passing on messages about how to access support in the community, through to very confident and extremely confident. So just to sort of summarise, we need those strong, resilient communities. We need information about community groups, community opportunities, movements, and we need that information and resources, and we need that all in one place so everyone can access that information. But we need that well mapped and well resourced with funding. We need those access points, so that's website directory, ideally phone line, and those physical places like talking cafe, talking benches. We need those people spreading the word about those access points, for example, community connectors, but you can also have other kind of connectors, like we've got digital connectors who pass on information about digital access points and all these other connectors, and that creates a bit of a movement. And you also need those one-to-one workers who can work one-to-one in groups, whether they're social prescribing link workers or health coaches, but important for them to work one-to-one in groups to do a bit of community development, to know where the gaps are and to build in that support, to get involved in projects, to work alongside GPs and clinicians, and to offer training to become a connector to people they're working with and community groups. So it's all of these things working together that for us has really kind of created that mature social prescribing model and that whole community approach. So we've got those doctors being able to signpost and do social prescribing, working within MDTs, our health connectors working one-to-one with people and in groups. We've got those access points that I mentioned early on that signpost to all those strong and resilient things out in the community that are hopefully well funded. And then we have the connectors out there in community supporting each other by telling people that there is support out there rather than people saying, if I knew I'd known that. Oh, what the dog's doing. And just to say that health connections, social prescribing, health coaching and community development and creating all those connections is good for us, good for communities and good for the planet. Thank you very much and over to the panel. Bye.